Hey, I'm Dr. Paul. I'm a psychiatrist. My last name is Looney, so I get lots of jokes about being the loony psychiatrist. Today, I want to talk to you about a medication that is frequently overlooked. It actually came into use in the United States while I was in residency back in the 80s. So I've been in psychiatry for almost 4 decades. And this, in my opinion, is the number one medicine to use in treating anxiety. Now, it is considered a second line treatment because the most commonly prescribed medications in our country for anxiety are the SSRIs or SNRIs. That stands for serotonin specific reuptake inhibitors or serotonin norepinephrine reuptake inhibitors. The reason I am not a fan of them is that, well, there are several reasons. One is they tend to have more side effects, specifically the things that I despise, unless I'm treating somebody that's very skinny, is weight gain. I also do not love the sexual dysfunction that often goes with those medicines, nor do I like what seems to be an emotional blunting that often goes with those medicines. In fact, some people tell me that they make them so so free of anxiety that they can walk past the dishes in the sink and it doesn't bother them at all. Um, in addition to that, the SSRIs and the SNRIs can be very difficult to get off of. They tend to have a withdrawal syndrome that can be very difficult, and so the weaning process takes time. The medicine I'm talking about is one that's called Buspirone or Buspar, and if you found this video, you probably are curious to hear about it. It is in a class by itself. There's not another medication that works in exactly the same way. It's a serotonin um, agonist and antagonist. That means in some ways it ramps up the effects of serotonin, in other ways it dampens it down, which in terms of usage in psychiatry is a good thing. It tends to lower anxiety so that people with generalized anxiety disorder or other anxiety disorders, including OCD, can greatly benefit. Now, aside from the SSRIs, the other medicine group that's used to treat anxiety typically are the benzodiazepines, which include things like Librium, Valium, Klonopin, Ativan. And those medicines are very effective and quickly, but they also have a high potential for abuse and dependency. So, again, not a big fan. If you're going to use one of those for occasional use, if you have a panic attack, for instance, or occasionally for insomnia, that's a really good option. But for long-standing anxiety, buspirone is the bomb. Now, the thing is that you have to be patient because unlike the benzodiazepines, it does not work like that. It takes time. Typically, when you start the medicine, you won't notice much until you've been on it for a week or two, maybe a little longer, and the positive effect continues to ramp up over about a 2 month period. So you're not going to get the full benefit for a couple of months. So it's not a quick fix. It's not something you want to take for short term anxiety. But if you're someone whose brain is prone to anxiety, Buspar may be just what you need. Buspar is the brand name, and the typical starting dose in my practice, for most people, I'll give them a 15 milligram tablet. It's a little elongated thing that's scored where you can break it into half or thirds. And I generally start people on a half a tablet, which was 7.5 milligrams twice a day. It was originally designed to be taken 3 times a day, but most people can't remember a midday dose. And in fact, there's some research that says that twice a day dosing is just fine. So that's what I do. Half a tablet in the morning, half a tablet in the evening. And then if there are no side effects, to advance to the full thing. Most common side effects are dizziness, nausea, headache. There are a few other random side effects, but for most people, I'm happy to say Buspirone has very low incidence of side effects. If they do show up in the first few days or weeks, they typically will attenuate or go down, diminish in intensity as the person continues on the medication. For most individuals that I've prescribed it for, they don't really feel like they're taking anything. They don't feel drugged or drowsy, although rarely someone will say that the Buspirone makes them drowsy. For most people, it just brings down that high level of agitation and lowers anxiety. For some people who struggle with anger, particularly men, when you think about the fight-flight mechanism, the chemicals that are released, whether you're in fear or agitation and anger, similar chemicals. And so for some people who struggle with irritation, irritability, anger, Buspirone can also calm the brain, bring that level of agitation down so the person is less volatile, less agitated and irritable, which is a good thing. So I think the other advantages of Buspirone is you can stop it when you're ready. It's not likely to have any kind of withdrawal effects, and you can start it back up if needed later. There are some people who come in the world with an anxious brain, though. If you watch it, babies just fresh out of the chute, some babies are kind of like laid back and like taking it all in, and you come up behind them and clap, and they're like, "What was that?" But other babies come out really wired and super vigilant in their awareness of the world. And you come up to them and clap your hands, they're going to be like, "What was that?" And so, if you have an anxious brain, don't be down on yourself, because anxiety actually is a powerful emotion, and a little bit of anxiety actually enhances our alertness, and even our performance is enhanced with a little bit of anxiety. But beyond a little bit of anxiety, a lot of anxiety impairs performance. It can paralyze us. It can really rob us of energy and focus, and really derail a lot of the good that we would like to do. So if you're an anxious person or know someone who's anxious, consider a conversation about Buspar with your physician or their physician, because I think it's underutilized. Now, be aware that the doctors that don't use it very much are prone to under-prescribing. They might give like 5 milligrams twice a day, which is probably not going to be enough. Somewhere between 20 and 30 milligrams a day in divided doses is usually going to hit the spot, but you can go up to as high as 60 milligrams a day, which would be 30 in the morning, 30 in the evening. I think non-psychiatrists tend to be a little bit more ginger or hesitant about prescribing medicine. And I tell people you can always let off on the gas once you get up to highway speed, but when you're trying to get the symptom relief that you need, I'm more inclined to push the dose to get the desired benefit and then back off for maintenance as you're able to. So I hope this little review of Buspirone has been helpful. Just be patient with it. If you've been on an SSRI or been on a benzodiazepine, you're going to have to get used to the fact that you don't feel anything, because with the other medicines you can feel it sometimes when you take it or if you stop it. With this one, it's much more subtle but powerful over time if you'll stick with it. So hope this is helpful, and I hope you find all the help you need. This is with the understanding that medicine alone is not the answer to your problem. Your problems will still need to be faced, but bringing your anxiety down may empower you to deal with your problems. And of course, there are lots of behavioral strategies that are helpful with anxiety. Journaling, counseling, breathing, meditation, prayer, all those things are super helpful. So please don't think that this video is just all about the drugs. I love you.